My name is Liz Cullen. I am a medical doctor and a member of the Irish Doctors Environmental Association. We are concerned at the impacts of chemical contamination in our environment and exposure to non-ionising radiation on our health. In relation to chemicals in our environment, there are currently 100,000 chemicals in common use today. These chemicals are found in our food, in our cosmetics, in cleaning agents, in our food and in our water and in our air. We do not know the long-term effects of exposure to such chemicals. Many of these chemicals have been found to have endocrine disrupting properties. That is, they mimic the female hormone estrogen. Already, signs of the impacts of estrogen on our wildlife have been documented. In relation to non-ionising radiation, we just don't know the long-term effects of exposure to radiation from mobile phone masts. The most recent report, the EU Shenia report, has stated that it is just too soon to be certain. Often, however, when we express concerns about exposure to chemicals or exposure to radiation, we are told, oh, we have no evidence, or their evidence isn't there. What we need is a systematic way of assessing exposure to environmental contaminants. We would like a register of people when they are first diagnosed with Parkinson's disease, Alzheimer's disease, all the chronic diseases and cancer. And we would like to know what was their diet, where did they live, was it near an illegal landfill site, what was their occupation. We want all the information of exposure to environmental contaminants. We need to collect the evidence. We need to collect the evidence so that we can protect our people from exposure to chemicals and the effects of non-ionising radiation. So I would like to ask you, how do you intend to protect the public from exposure to the ever-increasing and accumulating levels of toxic substances in our environment?